9 feminine hygiene tips. Tip 1. Develop healthy eating habit by taking food that contains vitamin C, vitamin E, zinc, omega-3 fatty acid and iron, and also probiotic. Research have shown that anemia is one of the conditions that women have within childbearing age. Tip 3. Keep clean. Vulva, not the vagina. Clean it with mild soap that do not contain harsh chemicals or contain chemicals like sodium lauryl sulfate. Check INCI beauty ingredient to be sure of what you are applying, or you can browse INCI recommended products. I have a video on how you can use INCI to check your ingredient products, so check it out in my playlist. When do you clean? After going to the toilet to pee or to poop, after sex, while taking your baths, and during your menstrual cycle. When you poo, clean the vulva separately from the anus. Clean from front to back, then clean the anus separately. Keep the pubic area completely clean by trimming or completely removing the hair. Use new blade so as not to increase the chances of having ingrowth hair, and place warm towel on the surface before you begin shaving to reduce the chances of having ingrowth hair or irritation. Wear cotton panties to reduce the chances of infection, and change it every 6 months. If you notice any pain, itching or irritation, go see your doctor, and don't forget to do your every 3 years pap smear HPV test. Every day, check the smell of the vagina, check the texture, check the surface. You can use Milo to check, or you go and meet a gynecologist to help you do your physical checking. This will aid early detection of certain conditions, and it will also lead to early treatment and aid in prevention of complications that can lead to infertility. Take note of your premenstrual cycle syndrome like acne, like mood swing, like pain, so you can handle this as it comes, or you visit a medical professional to help you handle it. Spend some time in nature because it does a whole lot of good in our mental health.